would like to thank the scientific organizer who kindly select me for this honorable presentation here. This presentation is for the beloved memory of Professor Yup Lange, which I'm sure that all of you here also love Yup, that's why you are here. Yup is both a doctor, researcher, and activist, and he's the greatest proponent of test and treat. I first knew Yup in 1992 when I served as a member of the steering committee of the WHO unit led by Yup in Geneva. In 1996, together with David Cooper, Yup helped me setting up Asia's first clinical trial center, HIPNAT. And then 2 years after that, I also first got to know Jacqueline when she came along with Yup as a head nurse of the clinical trial unit that Yup led in Amsterdam. In fact, I had a dinner appointment with Yup in Melbourne on July the 22nd. But a few days earlier, July the 18th in the morning, which is about nighttime at Amsterdam time, I was told by Chris Bearer, during the time that he and I will be on the stage for a pre-conference, that Yup and Jacqueline had passed away because of the plane shot down. HIV/AIDS in Asia Pacific has not well represented either in this conference or any other conference. No one could describe anything or predict anything better than Greg Doe, who mentioned this about 20 years ago, saying that HIV/AIDS in Asia will have enormous consequences of a region encompassing more than half of the world's population. I think Greg is right. Yup was among the first people who paid attention to the HIV/AIDS epidemic in Asia. I will then talk about the establishment of HIPNAT, the overall effort of Thailand and also of the Thai Red Cross AIDS Research Center in ending AIDS using the test and treat strategy championed by Yup. Then I will end up by saying, how can other Asian countries do it better? There are about 350,000 new infections just in 2013, whereas new infection in many countries in Asia has been decreasing, but it is increasing in 3 countries, Philippines, Indonesia, and Pakistan. 3 big countries, India, China, and Indonesia, compose of about 80% of new infections that year. These 3 big countries together will then pose a potential time bomb for HIV/AIDS in Asia. I would like to honor by naming a few people who came to Thailand in the early epidemic. First, Scott Hammer from Harvard University. He came to Thailand in 1989 in order to discuss about some collaboration that can be done with Thailand. He then brought in the first ARV trial in Thailand. Later on, David Cooper from University of New South Wales and Yup Lange from University of Amsterdam then came along in about 1994, 1996 to form HIPNAT. HIPNAT stands for the HIV Netherlands, Australia, Thailand Research Collaboration, which is collaborative effort between a unit in Amsterdam, initially called International AIDS Therapy Evaluation Center, IATEC, which later on changed to Amsterdam Institute of Global Health and Development. And just last week, this institute was named after Yup Lange Institute. And also from David Cooper, initially from National Center in HIV Epidemiology and Clinical Research, NCHECR, now also changed a new name to a Kirby Institute, whereas the name of the Thai Red Cross AIDS Research Center has never changed. During the last 20 years, HIPNAT has made quite a lot of progress. The clinical studies done by HIPNAT has contributed to improved patients' care in Thailand and internationally. Each year, about 600 to 800 people from Asia will come to the annual HIPNET Symposium, where Yup and David always being the speaker every year. Most importantly, I think HIPNET has saved thousands of lives for the last 20 years by having up-to-date medications. There are several areas of clinical studies that HIPNET is doing, starting from PK, viral co-infections, TB, strategy like START trial, and new drugs, and also pediatric clinical trials. People who certainly look older with the 14, 15 years span. Yup is the youngest among three of us here. You can see the list change of Yup from 1998 to 2012 as compared to David Cooper and myself. Yup is also very interested or very keen in human resource development. In the 2013, 5 PhDs from the Thai Red Cross AIDS Research Center graduated from Amsterdam Academic Medical Center in Amsterdam on the same day. 5 PhD graduated on the same day, which is unusual for University of Amsterdam. Next, I'm going to take you to another research unit of Thai Red Cross AIDS Research Center called SEARCH, which is founded by Dr. Jindanath, the pretty lady that you saw in the previous slide. Together with the US Army, SEARCH are doing the so-called acute HIV infection study. Probably you have seen this slide many times along this meeting here. In order to say that people who are treated early, for example, within 14 days of viral entry, they stand a good chance of functional cure or long-term remission, because even up to 24 weeks after ART, none of them have any integrated DNA in the reservoir as compared to those who are treated from 2 to 4 weeks or longer. Now, I'm going to take you closer to the Thai Red Cross AIDS Research Center, especially the anonymous clinic, which is the main source of the patients for HIPNET and SEARCH. As you can see, from 2008 to 2013, 2014, number of clients who come to the anonymous clinic for HIV testing increased from 8,000 to about 24,000 the last year. The proportion of MSM also increased sevenfold during this seven-year period. The prevalence of HIV among MSM in our clinic is around 21%. One of the reasons that so many MSM come to the anonymous clinic for HIV testing, because we have this anal dysplasia screening service at the clinic as an entry point for people to come in for anal pap smear, and then almost 90% of these people who come for anal pap smear will then end up with HIV testing, whereas they never thought about HIV testing before. With the experience that we have with the anal cancer screening, a network was formed, so-called Anal Dysplasia Study in Asia and Pacific, or ANZAP network, together with Professor Joe Palevsky in San Francisco. The network initially just only in Thailand, Malaysia, and Indonesia. And this project is supported by Treat Asia and AMFA. Now, it's my honor to introduce Treat Asia and AMFA, which is a mother organization of Treat Asia. Annette Sohn is the director of Treat Asia, whereas Kevin Frost, he used to be in Thailand for 20 more years. Now he's now the CEO of AMFA. Treat Asia is a network of clinical sites from 13 countries around Asia to work together, to work with the community in order to ensure proper treatment for HIV patients in Asia-Pacific region, to research, through education, and through collaborations. Online campaign or online education is a very important tool to fight against AIDS in Thailand, like a website. Adam's Love website is a bilingual edutainment website launched by Thai Red Cross 2011. This website itself brings in about 1/3 of the clients of an anonymous clinic nowadays for HIV testing. Similar websites, although not limited to MSM and TG, have been set up in Indonesia and Malaysia called Taman Taman. And a similar Chinese-based Adam's Love website was launched in Taiwan just a couple of days ago. I'm going to introduce the ongoing test and treat activities among MSM and TG in Thailand. The pilot feasibility and acceptability test and treat study was started in 2012 in 4 provinces. With the success of this pilot study, a bigger test and treat study was started in 2014 with 6 more provinces in Thailand. Comparing or looking at the feasibility of facility-based model with 2,000 participants in the facility-based model as compared to the community-based, community-led model, another 6,000 people. And a cost-effective analysis will be done along this study, and as well as a PrEP also included for those who are negative from the initial testing. This study is a big study being supported by various funders from both Thailand, the Netherlands, and the US. Thailand has the aim to end AIDS by the year 2030, not 2020. In order to reduce the new infection from 10,000 a year nowadays down to less than 1,000, the country has to expand its HIV testing to reach more than 90% of the key affected population, as well as to put them on immediate treatment, which is now in Thailand is not a problem because Thailand has the guidelines to treat everyone, irrespective of CD4 cell count. In doing so, one needs another $100 million for the next 10 years, which is only $10 million a year, which is not very much. But at the end of the 10 years, you will get 3 times more investment return. I am certain that most countries in Asia can also end AIDS. But leadership is needed. We have to target the policymaker because they are the one who controls everything in the country, to make them aware, to show them how to do it, what is needed in doing it, the benefit of doing it, benefit for themselves as a politician and benefit for the country, and also the cost of doing it, the cost of not doing it, and the net balance or net loss or net gain. We also need strong support from program implementers, academicians, media, and opposite parties, politician leaders. We also need strong support from international agencies, WHO, UNIS, in terms of either guidelines or technical and financial support, as well as voices and critics, not just always oppressed. We all need to be activists, either a doctor activist or international organization activist, in order to challenge the status quo. Jup is one of the doctor activists that I admire most. He always says, patients first, research later. He is a strong advocate for access to ART and PMTCT in developing countries. Also a strong advocate for treatment as prevention. According to the slide that he presented in this city last April, where he gave the slide to me, I will quote it here. It is pivotal that different treatment as prevention scenarios are being explored in effectiveness studies. They should inform, but should not delay the planning and the rollout of treatment as prevention. JUP is also advocate a lot on early diagnosis and early treatment, so-called test and treat. If JUP had a chance to know that what happened to the STAR study, I'm certain it will have a big smile. JUP also a very strong advocate for non-complacency. I just want to quote you in one of his articles, so-called Under the Spell of the Red Queen. We need to run at least twice as fast as we are currently doing. Know our classics, act upon them, and upon new opportunities, and keep our eye on the target at all times. The objective of this presentation is to call for more international, more regional, and international responses to the problem of HIV/AIDS in Asia. After recognizing the problem, learning what can be done, what has been done. I would like to call for more rapid and more comprehensive national response as well as national investment. I'd love to see more regional collaboration between the countries with more experience and more resources like Japan, Singapore, Taiwan, and countries with less experience and less resources. More international collaboration is also in the region is also needed, especially North-South type of collaboration. Be aware that when I call for regional international attention or responses, it doesn't mean that I call for more financial and technical assistance. Because such collaboration is also can be advocacy, which may not pay anything at all. And it's also a bidirectional learning experience for both donors and the recipients. That is mutual benefits. Before I will end, I would like to acknowledge individuals and organizations whose names and photos were shown in the presentation, as well as those who were not shown, but had contributed significantly to the fight against AIDS in Thailand and in Asia. And also I'd like to thank individuals or organizations who will then commit and invest more in ending AIDS in Asia after listening to this presentation. The last slide here is the picture of Yup and Jacqueline at the cover page, front cover page of the annual report of HIPNET published January this year. Lovely picture. Yup and Jacqueline, we miss you. We will follow your footsteps and fulfill your vision. Thank you very much for your attention.